Good afternoon and welcome to today's webinar titled Occupational Noise-Induced Hearing Loss and Audiometry Evidence Review. Budjeri Kamaru, I'm coming to you from Gadigal land. I would like to acknowledge the traditional owners of the lands we are meeting on today, wherever they may be. I am meeting on Gadigal land and I offer my respect to elders past and present and to any traditional people who are attending this webinar today. SIRA is in the process of undertaking a comprehensive review of work-related hearing loss claims and their pathway through the workers' compensation system. Included in this work are the findings of the rapid review conducted by the John Walsh Centre for Rehabilitation Research. Information on the full review are available on our website, and participants of this webinar may also be interested in two other pieces of work SIRA has published: a workplace adjustment toolkit for workers with hearing loss and a hearing aid maintenance guide for workers. Today, Professor Ian Cameron will present the findings of the rapid review undertaken on behalf of SIRA. Without further ado, please welcome Professor Ian Cameron.
Good afternoon. Welcome to this webinar. The topic is Occupational Noise-Induced Hearing Loss and Audiometry, Conclusions from a Rapid Review. My name's Ian Cameron. I work at the John Walsh Centre for Rehabilitation Research. The presentation that I'm about to give is coming to you as a pre-recorded segment and will be followed by a live question and answer session. The question and answer will be moderated with the assistance of Annette Key from State Insurance Regulatory Authority. As questions come to your mind during the presentation, I encourage you to submit them by clicking the dark blue hand icon located in the toolbar at the top of the webinar screen. Any technical difficulties, please phone Redback Support. I understand the number will be on your screen, but it is 1800 733 416. The final housekeeping is to let you know that SIRA will send an email to everyone registered for today's webinar when the captioned recording and a copy of the presentation slides are available from the SIRA website. So to begin, the background for this topic is that SIRA commissioned the John Walsh Centre for Rehabilitation Research to conduct a rapid review on occupational noise-induced hearing loss and audiometry. So defining a couple of the terms: occupational noise-induced hearing loss, sometimes abbreviated to NIHL, is hearing loss due to excessive noise at work. And what's audiometry? It's measurement of the range and sensitivity of a person's sense of hearing. We did a literature search from 2010 to the present. We were updating an existing review by Smart and colleagues, and then we searched health-related databases and also did Google searches. The first three slides give you the key findings of the rapid review, and then we'll work through an explanation in greater detail. So firstly, hearing aids are effective for improving listening ability and quality of life for people with work-related hearing loss. For the hearing aids to be most effective, there needs to be an initial and careful assessment of the particular worker and details worked out of what the individual's needs are. The hearing aid should be carefully prescribed based on a range of factors. Pure tone audiometry is the gold standard of audiometry for determining the type and degree of hearing loss. There are other tests that are available, but audiometry is the basis. So this audiometry can be done by otolaryngologists, more commonly in Australia called ear, nose and throat specialists, audiologists and audiometrists. The audiologist and ear, nose and throat specialist are also qualified to interpret the results and specifically diagnose noise-induced hearing loss. A key finding is that it can be difficult to differentiate between noise-induced hearing loss and age-related hearing loss. And so there are multiple factors that need to be taken into account. This is work history, particularly the noise exposure history at work and sometimes outside work. And there are also other factors that can affect hearing. For example, there are certain other health conditions that can influence hearing. The research shows that by 70 to 80 years of age, hearing loss is evened out between those exposed to occupational noise and those not exposed. It's important to realise that noise-induced hearing loss will not worsen after exposure to noise has ceased. In terms of treatment, as I said, amplification devices, in other words, hearing aids, are useful, but there also should be audiological rehabilitation, which has multiple components and aims to reduce restrictions in daily life for the person with hearing loss. It is difficult to help people to adhere to hearing aid use as much as would be ideal. Hearing aids do require training to use most effectively, and that should be part of the treatment provided. There's a wide range of prices for hearing aids. There are now digital hearing aids which are more effective. They tend to be more expensive. These are the areas of questions that were addressed in the rapid review. There were 3 questions related to diagnosis, 2 related to treatment, and 1 related to assessing outcomes in terms of the treatment provided for noise-induced hearing loss. So we're going to look first at diagnosis. So on the right side of the slide, I've reproduced an audiogram. The blue and red lines are the right and left ear, and the recording of hearing at different frequencies is recorded. So conventionally, frequencies between about 250 hertz and 8,000 hertz are assessed. And this person has normal hearing. A loss of up to about 20-25 decibels is normal hearing. The banana-shaped grey area is there for a reason, which we'll look at in more detail later, but it aims to define how much hearing you need to hear common sounds of speech. So this audiogram's been recorded by most likely an audiologist or audiometrist and will need to be carefully interpreted. There are self-test hearing screening tests available. I've given the link for Hearing Australia assessment. So you can log on, it'll ask you some questions, and then it'll present you with tones like an audiogram, and then it will give you a result. You do need to interpret that carefully. So we are saying that you should use reputable places and people for assessment. Hearing Australia is a government-linked service in Australia that has a very good reputation. There are some reports that have been suggesting that, particularly for older people where free hearing tests are recommended, this then can lead on to really marketing of hearing aids rather than hearing rehabilitation. So the need to take care about recommendations, therefore see a reputable professional. So we've now moved on to noise-induced hearing loss, and that's a sensory neural hearing loss, meaning damage to the nerves of hearing. It's a high frequency pattern, 3 to 6 kilohertz, and it typically produces a so-called notch. So the hearing level goes down to a large extent, somewhere between 3 and 6 kilohertz, and then for higher frequencies again, in the example on this slide, it's at 8 kilohertz. There is some reduction in hearing, but it is not as severe as that notch at 4 kilohertz. So that's the classical noise-induced hearing loss pattern. And if that's a young person, as we'll see, that will generally be reasonably easy to interpret. But of course, it's older workers who are predominantly affected by noise-induced hearing loss. And if the worker's, say, in his 60s or even 70s, or female worker at the same age group, the pattern, the normal pattern for their audiogram can be different. I'll just show you. So this is so-called presbycusis. This is hearing loss associated with getting older. So on average, all of us have more difficulty with hearing as we get older. Of course, it's not universal, but it's very common. Same as changes in vision as we get older. Most people have difficulty reading close up once they're over 45, 50, 55. And so you can see in this pattern, for the higher frequencies, there's greater hearing loss. But in this case, there's not the clear notch. So there's 70 decibels lost at about 4,000 kilohertz. So that's quite significant. And then at 8,000, there's just 60, but it's, so there's not the notch. This is the age-related hearing loss pattern, presbycusis. So you can see the two audiograms can cause confusion in the older worker, and so there is significant interpretation needed by the person interpreting the audiogram, particularly in an older worker, as to what's noise-induced hearing loss and what's hearing loss related to aging. So these audiograms show what's normal at different ages, and also by male and female. So these are based on thousands or tens of thousands of people. This is a Korean study, actually. And there are differences between males and females, but as you can see, the dominant feature of these graphs is that as you get older, your hearing gets worse, on average, that is. So you can see at age 85 for males, if you like, it's almost, you could say it's normal to have hearing loss. Females, the loss with age is not quite as great in general. So this now takes us back to what's termed the speech banana. This is, I think, quite a good way of understanding why noise-induced hearing loss causes problems. So again, this is an audiogram. You can see on the right side vertical axis, there are there's a key that shows what's normal hearing, what's mild hearing loss, what's moderate, what's severe, and what's profound. And in the banana, you can see the the frequency and the loudness that's needed to be able to hear particular sounds. And towards the right-hand side, it's emphasised that F and S are higher frequency sounds that are going to be harder to hear. And so they're going to be particularly the ones affected by noise-induced hearing loss. Also, noise-induced hearing loss gives greater problems in a noisy background environment. So speech discrimination, particularly in a noisy environment, gets quite difficult. And of course, that's where we would all like to hear best, in a social situation where there may be background noise or other people talking. So noise-induced hearing loss is a big issue, as is hearing loss generally for older people. So this slide's about questions 3 and 4 related to diagnosis. Who can assess hearing loss? That's otolaryngologists, ear, nose and throat specialists, audiologists and audiometrists. Who can interpret and diagnose noise-induced hearing loss? That's ear, nose and throat specialists and audiologists. And why do we need a specialist to do it? Because it's complex, for the reasons that I've explained, and there's further layers of complexity over and above what I've explained. And so it really can be quite complex to try and sort out what's happening. And then there are serious health conditions associated with some types of hearing loss, particularly one-sided hearing loss. If there's hearing loss on one side, there's always a concern that there might be something localized around the auditory nerve, the hearing nerve, or the brain on that side. So that needs investigation. We're moving on to treatment now. So best practice treatment, this is a summary for management of noise-induced hearing loss, is preventing further hearing loss. So hearing protective devices should be used. Well, it should be used by everybody in a noisy environment. So if you're mowing the lawn at home, you should be using hearing protection. If you've got a noisy work environment, you should be wearing hearing protection from the first day. So then we've got amplification devices, so hearing aids, quite a lot of different types available now. The digital devices are superior. They can selectively amplify at different frequencies, and so that is helpful. And then there's this concept of adult oral rehabilitation, which includes sensory management to optimize auditory function. So that's the best hearing environment you can, and strategies to do that. The proper use of technology. And there are more sophisticated issues of perceptual training. So you can learn to perceive speech more effectively with practice. And then you can take a counselling approach, so trying to help people not withdraw socially and to cope with the hearing loss. So I've provided a reference there, which is a summary that's readily available on an internet search. If we look more specifically about the type and cost of the hearing aid prescribed, this is a difficult area, a specialised area, and there are studies about how ear, nose and throat specialists and audiologists work, and those studies suggest that they use a mixture of science and clinical experience. Through a lot of clinical experience, they know what sort of person might be suited by particular approaches. And so clearly the severity of the hearing loss is a key factor, but there are other factors such as self-efficacy. That means how much the person believes that they can overcome their hearing loss. Health literacy, so some people are more in tune to health issues. If they are, generally they'll be able to work more effectively with health practitioners. And then support from family or colleagues, work colleagues, can make a big difference. So if people are supported to use their hearing aid, they're accepted by those around them, they're more likely to continue to use them. And the next dot point, is saying that it's a whole package. It's not just the hearing aid. There does need to be support, training, counselling, rehabilitation, and some follow-up. We did look at the prices of hearing aids. What I've listed there is indicative. There is a very wide range of prices. So like I really call hearing aids a consumer product. Like any consumer product, it does pay to shop around to get the best deal. And I've mentioned that technology has improved and the digital aids do seem superior. So we do need to measure outcomes, particularly where there's occupational noise-induced hearing loss, because we do want to see that the worker gets a benefit from the treatment they've been provided. So the most obvious outcome measure is the hearing aid being used and how much it's being used. So that's pretty easy to ask about. But there are other standardised outcome measures. The International Outcome Inventory Hearing Aids, which I'll show you in a minute, gives a validated way of assessing outcomes in terms of provision of hearing support. There can be specific assessments in the occupational setting, so the use and effectiveness of the hearing aid actually in the workplace can be assessed, and you can also use general health-related quality of life measures. So well-functioning and well-used hearing aids are associated with improved general health-related quality of life. So this is the International Outcome Inventory for Hearing Aids. I'm not sure that you'll be able to read it. It is available through the internet, but this assesses 8 issues with reference to the use of the hearing aid, how effective it is, what do people think of the experience. It's a 5-item Likert scale, and you can sum it to give an overall indication of the outcome of the hearing intervention. This is a general health-related quality of life measure. It's the Eurocoil 5-dimension, 5-level measure. This is a quality of life measure that's used very widely in health research and also health economic research. It's valid, and it does give subscales that are useful as well as a total score. So mobility, self-care, usual activities, pain and discomfort, and what's called here anxiety or depression, so psychological symptoms. So it's useful for hearing interventions, but it's also useful for a whole range of other health interventions. We're coming to the end, so these are the key messages, the takeaway messages. Noise-induced hearing loss is common. It has serious consequences. It's best to assess by pure tone audiometry with careful interpretation by a skilled health professional. Noise-induced hearing loss can be distinguished from other types of hearing loss, but that can be difficult, particularly in older workers. Treatment is, first of all, prevention, if necessary, use of a hearing aid, and broader oral rehabilitation. Technology is definitely improving, but hearing aid use or effective hearing aid use requires motivation and training. Outcomes should be monitored, and particularly they should be monitored if hearing interventions are provided in a work-related setting. So we'll have the opportunity for some questions. Thank you. Good afternoon. We're now into the live question and answer part of today's presentation. We've got some questions through, but at this stage we can accommodate more, so please send them through. I'd like now to introduce the moderator for this part of the session. It's Annette Key from SIRA. So over to you, Annette.
Thanks, Ian. So without further ado, the first question for Ian is, the review stated that best practice treatment is a hearing aid, but it doesn't solve all of the problems, or does it? Thanks.
So, so best practice is, if there's significant noise-induced hearing loss, is to use a hearing aid, but it's a lot more than that. The hearing aid needs to take into the assessment and prescription of the hearing aid needs to take in the worker's individual circumstances, identify what goals the worker has, and then provide education and rehabilitation in the use of the aid, and as well as avoiding further loud noise if possible, and monitoring use over a period of time. Next question.
Thanks, Ian. Assessment of occupational noise-induced hearing loss is complicated, especially when the effects of age-related hearing loss are involved. How can we be sure that the hearing loss is work-related? Thanks, Ian.
The presentation and the rapid review point out that distinguishing noise-induced hearing loss and hearing loss associated with ageing can be difficult. The first step is to have the pure tone audiometry, but then there needs to be involvement of relevant professionals related to hearing to really try and work through the issues and sort out what the issues are, firstly, and then secondly, to look at what can be done. And so there are a number of health professionals that can do that, and they were mentioned in the presentation. Medical specialist, normally abbreviated to ENT practitioners, to audiologists and audiometrists. And so there's a complex assessment process that eventually will lead to a diagnosis. Of course, many people have a mixture of noise-induced hearing loss, and there is inevitably some changes in hearing as we all get older, as was pointed out in the presentation. Next question.
Thanks, Ian. The next question is probably not a question for you, Ian, but I will ask you. Does SIRA envisage promoting formal rehabilitation counselling services for workers with noise-induced hearing loss?
Okay, well, I don't think I can comment on a policy issue for SIRA. The rapid review and the presentation does point out that the worker needs significant support to adapt to their hearing loss and to manage it effectively. And that could be provided in a number of different ways. And yes, it would be up to SIRA to determine how that might occur.
Probably one thing I can say is that SIRA is continuing some work in work-related hearing loss, and a focus of this work is appropriate rehabilitation for workers. We haven't had any other questions come through So I guess this is an opportunity to open the floor and ask for more questions. If anyone has any questions for Ian.
Just while you're doing that, I just want to emphasise a few things from the rapid review and particularly the presentation. So there's a fair level of detail in the rapid review, but it doesn't address every issue on this topic of noise-induced hearing loss. It's a specialised area, and so there will be issues that are not covered. The actual presentation tried to provide an overview of noise-induced hearing loss, audiometry, and strategies that can be used. I did want to emphasise that prevention of noise-induced hearing loss is a very important topic, and so that is important in the workplace and in daily life. Appropriate diagnosis is necessary, but also ongoing support for workers, as we've actually discussed in some detail in response to the questions, also necessary. So it is a detailed and complicated topic, which I hope you've got some insights into following what we've done today.
Thanks, Ian. We've had a couple more questions come through. The first one is, do you believe that workers who are assessed at having less than 6% BHL would benefit from hearing aids?
Okay, this is a technical question. There is in relevant legislation and guidelines some thresholds of hearing loss that have implications for services offered. I have a personal view on the question, but I'm not going to give a specific answer because it wasn't specifically addressed in the rapid review. I feel it is more appropriate for a health professional with appropriate training in this area. My training's broader, and so therefore I'm declining to give a specific answer.
Thanks, Ian. The next question says, as we are not audiologists, how or who can we refer the results to for explanation when we receive a claim for hearing loss or request for aids? Does Hearing Australia offer insurers a service? Many thanks.
Okay, that's another quite difficult question. I don't know the specific answer. In general, I would think that specialist interpretation is needed. That's likely to be provided by an audiologist or ENT surgeon. I don't know procedures for particular insurers. I know in other areas of medicine there are approaches to consultants to give a further opinion. So again, I'm sorry, I don't think I can answer it more specifically than that.
Thanks, Ian. Lots of technical questions. Here's another one. Is there any way to determine when the hearing loss may have occurred?
In assessing a worker or just a patient generally with hearing loss, you do need to take a detailed history of noise exposure over life. And so that may give some insights in terms of onset of the hearing loss. Noise-induced hearing loss would normally be gradual onset. There are some types of hearing loss that are sudden. They're of more concern often in terms of understanding what they are. So to get back to the question, the history taken by the health professional involved may help answer that question.
Thanks, Ian. The next question is, did the review highlight information on the proportion of people who are issued with hearing aids but don't use them and the cost? Thanks.
The review did comment on that, but it did not have specific local data, New South Wales data. There are quite a few studies that do show that people who are prescribed hearing aids don't wear them. So that is an acknowledged issue. The literature suggests that best practice is to offer education and support over a number of sessions to try and assist the person use the hearing aid to address the goals that they have. So the answer is yes in general. We didn't find specific New South Wales data for that.
Thanks, Ian. The next question is there any difference between occupational noise-induced hearing loss as compared to listening to loud music via headphones, for example? Thanks.
Again, I'm not a content expert, but my understanding is that loud noise exposure through headphones can damage hearing, and the pattern can be effectively a form of noise-induced hearing loss.
Thanks, Ian. One more question that also may be outside of the scope of the review, because it's talking about chemicals. How do you distinguish workplace chemicals that can lead to hearing loss?
Good. So that's actually a technical question that I can't answer. The review, though, did not address that specific issue. The review looked at noise-induced hearing loss and audiometry. It did consider some other issues, particularly hearing loss associated with getting older, but it did not review specific chemical exposure.
Thanks, Ian. The ACCC conducted a rather scathing investigation on the current model of services to people of noise-induced hearing loss. Did the research suggest alternate service models? Thanks.
Yeah, happy to comment. Certainly we're aware of that type of issues. In the rapid review, we looked at the research literature in terms of what programs had been shown to assist the effective use of treatments for noise-induced hearing loss. And so, in general, those treatments tend to be the use of an appropriate hearing aid generally, and then appropriate follow-up in terms of assisting the person to use the aid. Those types of studies also looked at broader factors than the worker or the person using the hearing aid. So there are issues about adequate support from the workplace in terms of use of a hearing aid or a hearing rehabilitation program. Also issues related to support from the person's family and friends. And so an integrated approach is needed. There have been legitimate criticisms that in some cases there's been an undue emphasis on provision of a hearing aid with less emphasis on other important related issues. Next question.
Thanks, Ian. What would be, in general terms, the chance that a person who is 70 or older and has a hearing loss problem, is it due to age? Sorry, I'll reword that. What would be, in general terms, the chance that a person who is 70 or older has a hearing loss problem due to age and not employment? Thank you.
Yeah, so that would be a skilled professional assessment. So the audiograms in those settings can be hard to distinguish. So there would be a history taken of noise exposure, a history taken with reference to other health issues that the 70-year-old person might have. And then there are established procedures to try and distinguish the two. As I said before, though, that there will be quite a lot of 70-year-olds, particularly males who've worked in noisy environments, who have both noise-induced hearing loss and age-related hearing loss, so that both conditions will be there. Next question.
Thanks, Ian. That is the end of the questions. I guess it's another time to put another call out for anyone else who has a question or further clarification.
Okay, we'll just, while we're waiting for that, I just had a few housekeeping notes that could you please provide your feedback about the webinar. There's a link to be sent about a quick survey, and there will be an email notification of the presentation and recording being available on the SIRA website. So I'll go back to Annette for either the last question or to sign us off.
Yes, we haven't had any more questions, so I think we'll sign off.